Okay. Okay, well, we're going to go ahead and go live in another couple minutes or so with this HSTA Facebook Live. Okay. Okay, well, good afternoon, and thank you so much for joining us today. This is HSTA's Facebook Live. My name is Kali Pu'ohau. I'm with the Hawaii Employer Union Health Benefits Trust Fund, or the EUTF, and I'd like to thank the HSTA for this opportunity to address the membership with this year's annual open enrollment. So I will be going over the open enrollment PowerPoint presentation that we'll give in April. And if you want to follow along, we do have a PDF version of the slide deck available in the description below. It's the bit.ly/EUTF 2018. Again, it's in the description below. And of course, during the presentation, this is a live presentation. If you do have questions, go ahead and send your questions to us in the comment section below. Okay, so we're going to go ahead and get started. So this year, the informational session will be on the 2018 Open Enrollment Informational Session for active employees. So we'll be going over a lot of information regarding this year's annual Open Enrollment. And again, if you have any questions, please feel free to comment on the links below. Our agenda for this live session, we're going to go over important dates for this year's Open Enrollment, followed by changes for 2018, premium and contribution amounts, completing the EC1 or EC1H enrollment form, and then understanding your benefits. Okay, so important dates. The election period for this year's open enrollment will begin April 2nd, 2018, and will continue through April 30th, 2018. New coverage and rate changes will take effect July 1st, 2018. New premium deductions from paychecks for county employees, that will reflect on their July 15th paycheck and will continue through next year, June 30th, 2019. And for state employees, it'll begin July 20th and will continue through July 5th, 2019. Now, the deadline for employers to submit EC1 or EC1H enrollment forms to their Departmental Human Resource Office or Open Enrollment Designee or the EBU office is April 30th, 2018. Here's some changes coming July 1st for our health plan options. Effective July 1st for medical and prescription drug plans. For HMSA, the EUTF PPO and HSTA VB 9010 plan, coverage for in-network tuberculosis and screening will be covered at 100% for that plan. The EUTF 8020 plan will see an increase in their coinsurance for in-network maternity services. Up to 20% will be your coinsurance. For the EUTF 7525 plan, in-network outpatient laboratory and pathology services will no longer be subject to the $300 deductible. And for the EUTF HMO plans, we have two changes: increase of the emergency room copayment to $100 per visit, as well as 100% coverage for physical examinations under the EUTF HMO plan offered through HMSA. CVS prescription drug changes. The maximum out-of-pocket limit for the 7525 HMSA PPO plan will increase from $1,850 for single, $3,700 for family, to $2,350 for single, and $4,700 for family. Again, if you're having difficulty seeing the slides, we do have a link below bit.ly EUTF 2018, where you can actually view a PDF version of these PowerPoint slides. Okay? Effective January 1st, 2018, for medical and prescription drugs, the supplemental plan currently offered under Rural State National will have a change in their vendor. So EUTF supplemental plans and prescription drug plans will now be administered by Hawaii Mainland Administrators, or HMA. So this benefit will not, there will no longer be chiropractic coverage under the supplemental plan. The plan year maximum will be $2,750 per person on the plan, and the prescription drug sublimit is $250 per person. Chiropractic benefits. So if you didn't know, all of our HMSA and Kaiser plans are bundled with chiropractic coverage. The chiropractic coverage under HMSA and Kaiser plans currently being offered through ChiroPlan Hawaii. We will switch the vendor. The new vendor for the chiropractic plan benefits will be American Specialties Health Group, or the ASH Group. Okay? There will be no changes to the benefit, however. So for EUTF members, it's still a $15 co-payment for your chiropractic services. HSTA VB members, the co-payment is $12 per medically necessary visit, up to 20 visits per calendar year. To locate or to find participating chiropractors, you would go to your respective carrier. So for HMSA members, contact HMSA to find out which chiropractors participate with the new American Specialties Health benefits. There's also a link available. It's the ashlink.com/ash/HMSA. For Kaiser members, you can either contact Kaiser or go to the Kaiser version of that link. It's ashlink.com/ash/Kaiser HIC. Administrative changes. So effective January 1st, 2018, all required proof documents must be submitted before EUTF will process any changes to your enrollment. Okay, and these coincide with changes to our administrative rules. Our reference guide is available on our website, eutf.hawaii.gov, and premiums are available in the reference guide beginning on page 16. Also on our website is our premium calculator. This is a great tool for employees covered under the plan that they can utilize during open enrollment. If you're wondering, hey, if I did switch my plan, let's say you're under the HMSA 80/20 plan, for example, and you wanted to see how much it would cost if I did switch to like a 75/25 HMSA or a Kaiser standard plan, you can utilize our premium calculator. Again, available on our website, eutf.hawaii.gov. And what you do is you go to the premium calculator, click the link, and then follow all the prompts, and it'll ask for information on your current HMSA plan. If you don't know your current HMSA plan, you can either contact HMSA or Kaiser or our office to get that information. But you input the information and the data, and then you can select up to 2 other health plans you're thinking about enrolling into. And this premium calculator will not only give you the current premium amounts annually in your current plan, but it'll also give you those same premium amounts if you decided that you did want to switch to an HMSA 75/25 plan, or a Kaiser standard, or a 90/10 plan. So it's a great tool that our members can use just to predict their possible expenses regarding the premiums. Now, these are just estimates. They won't reflect exactly what will be pulled out of your paycheck, but it's a good indicator on what kind of savings you could potentially receive if you did switch plans. We have a new EC1 enrollment form. There's actually 3 new forms. There's an EC1 enrollment form for all bargaining units except bargaining unit 12. And then we have the EC1H form specific for HSTA VB members who are currently on HSTA VB plans. They have their own form. And then there's EC1 form for bargaining unit 12, which are predominantly police officers. They have their own EC1. So I'd like to just go quickly through the new EC1 form, get you familiar with. This is what you're going to fill out if you decide that you did want to make changes during this year's open enrollment. Now, keep in mind, if you want to keep everything the same, you don't want to make any changes, no action needed on your part. Just don't fill out anything, don't turn anything in, and what you currently have now will automatically transition into the new plan year. Okay, but here's our new open enrollment form, the EC1 form rather. So it's similar to the old form. You want to check at the top there, make sure you're using the right one, depending on your bargaining unit. You fill out all the line items, and right here you mark open enrollment, okay, on the far right-hand corner. And then under the coverage start date section, of course, during open enrollment, we leave this section blank as all changes begin July 1. And then the plan selection area is where you, of course, you select the plan. And this is where this new form really comes in, really helps out here, because next to each plan option, we actually have the monthly costs. Okay, so now you don't have to fumble through our reference guide looking up the premiums and contribution amounts for each plan that you're thinking about selecting. It's all right there, the monthly costs available for you, not just for the medical options, but for the dental and the vision as well. Okay, so you fill out this section under our EC1 form. You flip the form over, you put your name on the upper right-hand corner, and under dependent information, any dependents you want to add during open enrollment, continue, or if you want to remove dependents, you populate the areas here, fill out all the line items. Keep in mind, if you are adding dependents for the first time, they've never been on EUTF plans before, we will need proof documents for your spouse or partner, a marriage certificate, civil union, or domestic partnership documents. If you're adding dependent children, we only need a birth certificate if the child's last name is different from the employee. But if it's the same last name, no birth certificate needed. Just complete the line items under this section. And we will need a student certification letter if you're adding dependents age 19 and older for dental and vision plans only, as their age limits for those for dental and vision is up to age 19, but if they're unmarried full-time students, they can actually continue to age 23. Remember, this is just for the dental and vision plans, but if you do have dependents over the age of 19 that are unmarried full-time students, you can continue them on your, or you can add them to your dental and vision coverage. We will need a letter from the school or university showing that they are full-time. And these proof documents must be submitted within 60 days. Section below there is other insurance information. So if you have health insurance outside of the EUTF, we'd like to know about it. If you could fill out this section here. And then the final section, employee signature, read the statement please, and then sign and date the form. Now you must turn in your enrollment form if you are making changes to your EBU office or departmental human resource officer or open enrollment designee on or before the 30th of April is the deadline this year. We also need all proof documents before we can process your enrollment. Now, that's a lot of stuff to remember. So this year we came out with an open enrollment checklist. And it's just a list if you're wondering, hey, do I have all the forms that I need or what the deadlines are? So there's this convenient checklist available on our website, eutf.hawaii.gov, that you can download just to make sure that you got all the paperwork required and that you submit your paperwork in a timely manner. Once we get your enrollment and your enrollment is processed, we will send out a confirmation notice to the employee showing the changes that we made for this open enrollment. Please keep in mind, however, that open enrollment forms will be processed during the month of May and June. So don't call us during May and June because we won't have your form ready. It's still being processed. But once we do process your form, you will get a confirmation notice in the mail. Is how you know that your form was processed. Every year our office gets bombarded within the months of April and May. Where's my form? Where's my form? Did you guys process my form? Probably not, because the processing normally happens in the month of May and June. But if you don't receive this confirmation notice by the end of June, then yes, definitely contact our office just to make sure that there isn't any problems. Now, once you do get your confirmation notice, go ahead, review it, look it over, make sure we put you in the right selections, make sure we spelled his name correctly. And if everything's good to go, keep it for your records. If there are any errors, of course, contact our office so that we can make any corrections. Understanding your benefits. So with this section, we've done this section the last couple of years because it's important for us that employees are not just enrolled in health plans that they like, but they are enrolled in health plans that work best for them. Okay, so here's some things to consider when you enroll or when you're considering maybe changing or staying in the current plan you have, some things to think about. Of course, you want to consider premiums with these health plans. You know, premiums can be quite a bit. Premiums, of course, is the monthly amount paid for your health insurance, and it's shared between the employer and the employee. Another thing to consider is deductibles. Okay, so deductibles, they don't always apply to all plans, nor do they all apply to all services. So I'll give you an example. The 7525 HMSA PPO plan has a $300 deductible per individual or $900 per family. So this deductible applies to most services covered under the plan. So it works a lot like car insurance. So if you legally drive in the state of Hawaii, you have to have no-fault insurance covering your car. If you do get into a fender bender, let's say you have a $500 deductible on your vehicle. If you get into a fender bender with $1,000 worth of damage, you know that the first $500 is coming out of your pocket. And then once that deductible is satisfied, that's when the car insurance the benefits will kick in and help cover the rest of the damage. So deductibles on the health insurance work the same way. So with this, again, with the 7525 plan, it has a $300 deductible. That means that you have to pay the first $300 worth of services before you get that 25% benefit coming from that plan. But the deductible does not apply to all services. So for example, the office visit, when you see your doctor under the 7525 plan, that service rather does not, the deductible doesn't apply. And come July 1st, your laboratory and pathology, as I mentioned earlier, will no longer be subject to the deductible as well. Also, very important to remember regarding deductibles. Deductibles, especially the medical ones, not only can they not be paid in advance, but they run on a calendar year, okay? And a calendar year is from January to December. Now, what that means is the deductible renews itself every January. So many of you, a lot of our members signed up for the 7525 plan July last year, and they might have met their deductible maybe a few months later, maybe in September. And then when January rolls around, they discovered that they have to satisfy a brand new deductible. Again, remember, deductibles for the medical renew themselves based on a calendar year, which is from January 1st to December 31st. We also have other benefits that renew based on a plan year. Plan year for the EUTF starts July 1 and goes all the way to June 30th. So examples of that would be your dental maximum. So our dental plans have a $2,000 maximum per person on the plan, which means you can use up to $2,000 worth of services every plan year. But that dental maximum, that $2,000, doesn't renew in January, it renews in July. Okay, so the benefits vary as far as it may be based on a calendar year or a plan year. So it's good to know how these things work. There's more information available in our reference guide regarding this topic. In-network versus out-of-network. So whether you're seeing your doctor, a dentist, a vision provider, you always get the bigger bang for your buck going to in-network providers. Now there are some our plans, like the PPO plans, that do allow you to go out of network and offer some kind of benefit, but it's not as high as if you go to an in-network provider. So just keep in mind, you always maximize your benefits by going to an in-network provider. Co-insurance and co-payment. So this represents your out-of-pocket. So when you look at our literature and our reference guide, whenever you see co-insurance, it's always your out-of-pocket based on a percentage. Like for example, the HMSA 80-20 plan. For most covered services, HMSA covers 80%, and then your co-insurance or your out-of-pocket is the remaining 20% balance, okay? Co-payment is always based on a fixed dollar amount. So for you Kaiser Standard members, Kaiser covers your doctor visits, all you pay is a $20 co-payment. Or when you pick up your generic medications, it's a $5 co-payment. So that's the difference between those two. And then finally, maximum out-of-pocket. So this is your financial protection in the event of a catastrophic injury or illness. So all covered co-insurance, co-payments, and deductibles apply towards a maximum out-of-pocket. So basically what happens, it's a calendar year benefit. It resets every calendar year. Beginning in January, when you get services done, medical services, you see your doctor, you have a procedure done, you pay your co-insurance or your co-payment, the insurance companies keep a running tally of all your out-of-pocket. And if any time during the calendar year, your out-of-pocket exceeds one of these maximums, so let's look at the HMSA 80-20 plan. For a single, the HMSA 80-20 plan maximum out-of-pocket is $2,500 for an individual. $5,000 for family. Okay, so what that means is with this maximum out-of-pocket benefit, let's say you had a real expensive hospital service, $2 million hospital service. You're not paying 20% of $2 million. Your out-of-pocket stops at $2,500. That's what this benefit is designed to do. And again, it does reset every calendar year. So beginning January 1st, everything goes back down to zero, and then it starts accumulating all over again. Okay, well, I understand there was a lot of concepts just now, but we have a few examples that kind of ties in all these examples together. Okay, so in this example, we have Rick, okay, and he's considering enrolling in either one of our PPO plans, either the 90-10, the EUTF 80-20, or the 75-25 HMSA plans for just himself. Okay, so the first thing we want to look at is the premiums. So the annual premium for the 90-10 plan, if he goes that route, for a 12-month period will cost him $4,042. This is using the July 1st rates. If he goes with the HMSA 80-20 plan, it's almost half that, $2,643 for the year. And if he goes with the 75-25 plan, you see quite a drop, pretty significant, $706, okay, between the plans, just looking at the premiums. Now, Rick is anticipating 4 doctor visits during the calendar year. His doctor's charge is about $100 per visit. This is before the health insurance benefits are applied. So if he goes with the 90-10 plan, it's a 10% co-insurance, okay, 4 visits, $100 per visit. His out-of-pocket is $40. There is a deductible under the 90-10 plan, but it really only applies when you see non-HMSA providers or non-participating. So this isn't the case. All his doctors are all in-network. So we're not going to run into the deductible. The maximum out-of-pocket is $2,000 for an individual. He only accumulated $40, so he's not going to reach the maximum out-of-pocket. So his total estimated annual cost there on the bottom is $4,082. Now, if he goes with the HMSA 80-20 plan, it's a 20% co-insurance or $80. The deductible will not apply, as will the maximum out-of-pocket won't apply either. So his total estimated annual cost is $2,723. With the 75-25 plan, the co-insurance is 25% or $100. Now this plan does have that $300 deductible, but the deductible does not apply to doctor visits, which is the type of services Rick is getting, so it's not going to apply in this case. So all Rick will owe on the 75-25 plan is premiums plus the co-insurance of $100 or $806. So of course, the 75-25 plan ends up saving Rick the most money in this example. Okay, so that's a simple example. Let's look at another one. Okay, so same plans, same individual. This time, Rick is anticipating $19,100 in medical services. Okay, and these services will apply to that $300 deductible under the 75-25 plan. If he goes with the 90-10 plan, co-insurance is $1,910, not quite meeting the $2,000 annual maximum. His total estimated annual cost is $5,952. Again, if you're having a hard time seeing all these figures here, look at the description below, bit.ly/EUTF 2018 for PDF versions of our slide deck, so you can have an easier time reading this, okay? Under the HMSA 80-20 plan, again, 20% co-insurance or $3,820. Well, Rick is not going to pay $3,820 because remember, the maximum out-of-pocket under the 80-20 plan is only $2,500. Okay, so his out-of-pocket expenses stop at $2,500. All right, so his total estimated annual cost under the 80-20 HMSA PPO is $5,143. Last one here, 75-25 plan, 25% co-insurance, but now we are running to that $300 deductible that will apply. So what we'll do is we'll take the $300 deductible off the top from the $19,100. That gives us $18,800. Now we'll apply the 25% co-insurance, okay, which is $4,700. Add that to the deductible that he had to satisfy, $300. To the penny, he ends up meeting the maximum out-of-pocket of $5,000. Okay, so his total estimated annual cost under 75-25 is the premiums plus the maximum out-of-pocket, or $5,706. So the lowest costing plan for Rick in this scenario actually is the 80-20 plan at $5,143. So we ran this example last year, and last year was a 75-25 plan. There have been some changes, some movement in the premiums, which actually affected the outcome of this example. So even if you're not making changes during open enrollment, you like the plan you're with, we always recommend that you at least check the premiums to see where you're at and to help predict, what kind of expenses you're looking at as far as premiums go for the new plan year. Well, we did single. Let's try a two-part example. So with a two-part example, $38,200 worth of services. There's a $600 deductible for the 75-25 plan since we're talking two individuals. The lowest costing plan ends up being, again, the 80-20 plan this year because there were some changes with the premiums. Last year was the 75-25 plan. And then finally, we have a family plan example, $37,300 worth of medical expenses for the family. So there's a $900 deductible under the 75-25 plan. The lowest costing plan in this scenario ends up being a 75-25 plan. And then we did want to do one last one. We don't want to leave Kaiser out. So here's a Kaiser example. We have Malia thinking about enrolling into either the Kaiser Comprehensive or the Kaiser Standard plan. So as far as the premiums go, if she goes with the Comprehensive, it's just for her, for single only, $3,128 for the Comprehensive. The Kaiser Standard plan, $768. That's over a $2,000 difference just in premiums. Malia will be undergoing, in this example, she'll be undergoing surgery in an inpatient Kaiser facility with an inpatient hospital stay to the tune of something like $50,000 as far as her medical expenses. Under the Kaiser Comprehensive, inpatient services are covered at 100%, so there's no charge. So if she goes with the Kaiser Comprehensive in this scenario, all she owes is the premiums for the year. If she goes with the Kaiser Standard plan, it's a 15% coinsurance or $7,500. Of course, she's not going to pay $7,500 because that maximum out-of-pocket. So you can see how this maximum out-of-pocket benefit works. It helps limit that out-of-pocket expenses regardless of how expensive your services end up being. So in this example, under the Kaiser Standard plan, it's the premiums plus the maximum out-of-pocket amount, or $3,268. So the lowest costing plan between the two Kaisers ends up being the Comprehensive, but not by much, by about $140. Here's some money-saving tips to think about. We're all trying to save money, and especially with our healthcare and our premiums. If you're on medications, we would like you to possibly consider generic over brand. Brand name drugs tend to be more expensive. On average, an employee can save as much as 80% on the out-of-pocket expenses switching over to generic. Of course, you always want to check with your physician first to see if there is a generic equivalent available for your condition and that he or she is okay with you taking the generic. Another way you can save money is, if you take prescriptions, is mail order versus retail. So if you are on maintenance medications you take on a continuous basis over a long period of time, mail order is the way to go. You can save about 33% on average getting your medications in the mail versus going to the pharmacy every month to pick up their medications. And the last one, emergency room for non-urgent care. We are encouraging our membership to use the emergency room only for emergencies, and just to keep that vehicle open for folks that really do need the emergency room. And another reason why is the savings that you can experience not going to the emergency room for something that is, for a condition that's not emergent or urgent, okay? And of course, if you wake up in the morning, you have chest pains, your arms feeling numb, definitely go to the emergency room. But we're talking about folks that use the emergency room more as a convenience. Your average ER visit runs about $1,200 for an individual versus the $70 that you pay waiting till Monday morning to see your doctor. Okay, so that's another way you can save money, by using the emergency room only for an emergency. Okay, and again, if you do have any questions about any of the topics we are going live, definitely shoot those questions over, and I'd love to answer them for you live here on the session. Okay. Our next topic here. A couple years ago, 2015, I believe it was, we started this new campaign, Be Well, Be Strong, where we've tried to encourage our membership to take advantage of the health and wellness benefits already part of your HMSA and your Kaiser plan. So we are encouraging our members to get your annual physical and screenings done. What's great about getting your physicals and screenings done is for just about all our plans, these services are covered at 100%, and they can really help our membership with early risk detection. You definitely, if you do have something going on with you physically, you want to catch it early versus finding out about it 10, 15 years down the road where it's a lot more difficult and a lot more expensive to treat. So get your annual physical and screenings done. If you're a smoker and you're thinking about quitting, both HMSA and Kaiser offer tobacco cessation products and programs to help you kick the habit. If you have a chronic condition such as diabetes, congestive heart failure, COPD, both HMSA and Kaiser offer disease management programs to better equip you, educate you, and provide support for your chronic condition. Okay, and the last one, health coaching. So it's a great benefit. I've personally taken advantage of health coaching under my health plans with the EUTF. If you're looking at getting into an exercise program or want to change your eating habits, there's some plans offer a gym membership at a discount. It's all available under both HMSA and Kaiser. And I believe we have a question.
We do have a question from Asa, who writes, are there any plans that are better for an expecting pregnancy and delivery, a mom who's going to be having a baby soon? Not sure about the cost for delivery and which plans are best for that.
Wow, okay. Well, you do need to know that the HMSA 80-20 plan, this year there was a change to the maternity benefits. Your out-of-pocket coinsurance is 20%. Is there a best plan? What I would suggest is look into our reference guide. We have a summary of the benefits and look under the maternity and see, see how they kind of work out between maybe like the 90-10 plan, the HMS 80-20, 75-25. Of course, if you're Kaiser, if you go to Kaiser doctors, then it's pretty straightforward. You can either go to the comprehensive or the standard. But once you've kind of had a good grasp of the different benefits, then you want to look at the premiums and see where you want to kind of fall. So it's a fine balance between knowing the benefits and then knowing what the monthly cost will be. And remember, whatever plan you decide to go with, next open enrollment, you can always switch it up to maybe say you decide to go with a more high premium, low out-of-pocket type plan, just to cover that pregnancy. Come next open enrollment, you want to go back down to something where you're at. That's always an option also. But I would definitely advise you to check the benefits. The benefits as far as what they offer for maternity, and compare that with the premiums and see how that feels for you. Yes?
You were talking about the reference guide that she could look up these different maternity rates. Where is that available? How do they get that?
Our reference guide, it's available for download as a PDF on our website, eutf.hawaii.gov. When you're on that website, there's a blue menu bar across the top. You want to click the active. And when it drops down, it's the 2018 reference guide. It was just uploaded about 2 weeks ago, and you'll find it there. Yes?
We have another question.
Love questions.
Lisa wanted to know.
Hi, Lisa.
What resources might be available for more information on the HMSA 75-25 plan? She was specifically interested in
Oh, okay. Well, we also have the summary of the guide, the summary of benefits available on our website. Same spot under the menu bar. Click active, and when that drops down, look for. I believe it's under medical. It's probably on the left-hand side of that drop-down window. You click medical, and they'll have all the different plans, the 4 HMSA plans and the 2 Kaiser plans. Click that, and it gives you a ACA-required summary of benefits that we need to have in there. And then, of course, if you want more details, you can check HMSA's website. I believe I do a Google search because I can't think of the address. Do HMSA.com and put EUTF in there, and it'll get you to the EUTF site for HMSA. And then there's a guide to benefits. It's probably like a 50-page document that goes into a bit more details as far as the benefits regarding the 75-25 plan. Actually, all our HMSA benefits plans available. Thank you, Lisa. Okay, all right. Advanced care planning, and I'm actually almost done. Advanced care planning, or ACP, is a covered benefit under all of our EUTF plans, both HMSA and Kaiser, both active and retirees. So the advanced care planning is a process of reflection, discussion, and communication that enables members to plan for when they are no longer able to make or communicate their decisions about medical treatment and care. So we highly recommend our membership to take advantage of this benefit. It's an actual visit to your doctor. But for more information as far as what the coverage is and how it works, we ask that you contact HMSA and Kaiser on details of the advanced care plan benefit. Okay, well, that's it for the slide deck, but if you folks have any questions, go ahead and utilize that comment section, and we actually have another one.
Yes, we do. From VJ.
VJ, how's that?
Is the 80-20 the best plan for a family of 3?
Best plan.
For a family of 3, 80-20.
So what's always dangerous about these questions when we get them during open enrollment is, postal comment, which is the best plan? Whatever we end up saying, if you end up not liking the plan, you're going to say, that EUTF guy told me to join that plan, and, we're going to be liable, right? So I'm not going to tell you which is the good plan. You want to look at the premiums, and you want to kind of look at how often do you actually go to the doctor. I mean, if your family's one of those, maybe once or twice a year, you may want to look at something like a 75-25 plan, and a lot of folks have I don't want to run into that deductible. Some guys, what they do is they flex spend the $300 difference, okay? So the money's there if they need it. So that's one way you can look at it, but check the premiums. But our most popular plan still is the 80-20 plan. 2 years ago, 50% of our membership was in the 80-20 plan. The 75-25 plan was our least popular plan. And then last year, when the premiums shifted, the 80-20 is still the most popular, but only about 37%. 22% of the membership is on the 75-25 plan. So there's a huge shifting as far as the movement of the membership. But hopefully that helps. But I actually will not tell you which is the best plan, though. Sorry.
And VJ did write back and said, no, we won't blame you.
Thank you.
We have another question for Robin, who wants to know, is the maximum out-of-pocket you were referring to earlier for the entire family, or is it per person in the family?
Oh, that's a great question. So the maximum out-of-pocket benefit, there's a amount for single, and then there's amount for family. So I'm going to quickly fly as fast as my thumb can click this clicker. There it is. So here's an example. Oh, and remember, each plan is different. So they're not all the same as 80-20, but we're going to pick on the 80-20 HMSA plan today. So for the HMSA 80-20, for a single individual on that plan is $2,500 is your max. Now, if 2 people, say you have a family of 12, if 2 people meet the maximum out-of-pocket benefit, then all 12 members experience that 100% coverage. Okay, so the way it reads in our literature is $2,500 per person or $5,000 for the family, or double of what the single rate is. Same with the 90-10 plan or the 75-25 plan. Okay, Kaiser's a little different. Kaiser is 3 times the amount. Okay, so for the Kaiser Comprehensive, $2,000 per person or $6,000 for family. Okay, or $7,500 in the case of the Kaiser Standard.
Another question that comes
yes.
about. Once members who have an HSTA VB plan
yes.
switch to an EUTF plan, right? They can never switch back to an HSTA VB plan. However, can those folks with an HSTA VB plan switch to a different HSTA VB plan?
So folks who are already on the HSTA VB plan, they want to switch from the 90-10 to the 80-20 HSTA VB, yeah, that's fine.
They can switch within HSTA VB.
Within HSTA, so there's 3 possible medical combinations, right? There's the HSTA VB 90-10, HSTA VB 80-20. Those are the HMSA option, and then there's that Kaiser comprehensive. So among those 3 plans, you can switch no problem. That's where we have that second open enrollment EC1H form is used for. So as I mentioned in the beginning, well, halfway through, but earlier, there's 3 new EC1 forms. So this one is for EUTF plan options, minus the bargaining unit 12, the police officers. And this is the form you would use if you're in that scenario. So you are on HSTA VB options. You're not going to jump to the EUTF, but you want to move around the different HSTA VB options. This would be the form that you would use. It's the EC1H enrollment form. Yeah. Yes?
Another question from Yvette.
Yes.
Wants to know, till what age are my college-aged children covered as full-time students?
Okay, that's a great question. So what are the limits to the age on your dependents? For medical and prescription drug, your dependents can remain on plans till age 26. Now that is regardless of whether they're going to school, not going to school, living with you, not living with you, married, not married, doesn't matter. The Affordable Care Act caused that change. Okay, but the Affordable Care Act did not affect riders like dental and vision. So the dental and vision benefits, your dependents can remain on plans to age 19, but if they are unmarried, full-time students, they can actually remain on plans through their 23rd birthday, ending at age 24. Just dental and vision. Any more questions? You guys are great. Okay. Well, I'll be here for a few more minutes, just in case you folks may have any other questions. And again, if you do have a question, just type in on the comment section below. And we have a team here, as you can see in here, that are answering these questions. But, and also, if you did want a copy of the slide deck that I'm using today, it's going to be the same slide deck we're going to use during open enrollment in the month of April. So you guys have got first views of it. Go to look in the description below in the paragraph bit.ly /EUTF 2018.
Okay, you can end it.
Okay. Okay, well, again, one last time, my name is Cully from the EUTF. We really appreciate this opportunity to address the HSTA membership with information on this year's annual open enrollment. We do invite you folks to continue to comment, even if you're watching this after the fact, if you do have any questions, because we will continue to answer these questions even after the live session is over with. And again, the link below does have copies of the slide deck, and there's also more information relating to open enrollment on our website, eutf.hawaii.gov. But again, thank you folks for this time and opportunity. And one last question, just squeezed in there.
Get them in. Yvette is asking another question. Can you talk about that flex plan thing? You referred to it earlier, the flex plan.
The flex plan thing, I did refer to it earlier. It's a great vehicle to use, like I used, in case you do want extra money aside to help cover your medical expenses, and there's other reasons. However, it's not offered through us, so I know of its existence, and I've enrolled into it. I've enrolled, but that would be with, it was Island Flex. If you're a state employee, they're switching their vendor. NSB, don't quote me on that. But I'm sorry, I don't have information on the flex. What's that? Contact DHERD.
And DHERD is the?
DHERD is Department of Human Resources.
The State Department of Human Resources for that information.
Yes.
Where they can apply to the flex plan.
Yeah.
Or where they can get the flex plan.
Yeah, more information on the flex plan. DHERD is a DHER, Department of Human Resource and Development.
And then somebody just wrote in, thank you very much for the information. Other people are writing in, thank you for this great
You're welcome. Thank you guys for attending. Thanks for the opportunity.
And where do they get more information if maybe they joined halfway through and they're not sure where everything is? Your website?
On our website, yeah, we have a lot of resources on our website. Shortly, we'll have an on-demand video and even webinars available on our website, eutf.hawaii.gov. So look out for that. That's probably going to go live probably sometime next week. And open enrollment, again, is from April 2nd to April 30th. Get your forms in if you are making changes to the EBU office on or before the 30th of April. And again, if you're not wanting to make any changes, no actions needed on your part, but do check the premiums just so you know what to expect come July as far as how that's going to affect you on a monthly basis. Okay, thank you very much. Okay.